Welcome all to this special webinar event in collaboration with Designs for Health and Emerson Ecologics. We are so pleased today. I am Amy Regan from FullScript, and I am so glad that you've joined. A few housekeeping notes. Please place all questions you have in the Q&A box for a chance for them to be answered during at the end of the presentation. This webinar will be recorded, and the recording will be sent via email to all attendees and registrants, and there's a copy of the presentation slides in the handouts section. It is my pleasure to introduce Christine Garvin. Christine Garvin, MA RWP, is a functional nutritionalist based in Asheville, North Carolina. She weaves together her personal health journey, including a fibroid surgery that nearly killed her, with her training in functional health and nutrition to help women heal their gut and get empowered when it comes to hormones. She has been featured in Health, Shape, Parade Magazine, and MSN. MSN, among other outlets. She is the host of the popular podcast, Hormonally Speaking, works with clients all over the world, offers group programs for gut healing and hormone health, and presents on stages throughout the United States, including this one. Welcome, Christine.
Thank you so much for having me, and thank everyone for being here today. I know it takes time out of your busy day, so I really appreciate you coming on here and hopefully learning some good information about fibroids. So what we're talking about today is the advanced approaches for tackling fibroids. Fibroids are a big issue. If you aren't already aware, you're going to learn today. So I'm pretty sure you probably know what a fibroid is if you're here, but I always like to start at a foundational base so that we are all on the same page. So let's talk about what a fibroid is. They are benign tumors, less than 5% of the, 0.5% of the time they're cancerous. They are sometimes referred to as uterine polyps or myomas, and they are made up of smooth muscle cells and fibrous connective tissue. So they are really, really strong little suckers. They contain abundant extracellular matrix, which includes a large amount of collagen. Okay, so continuing on, really fibroids are all about the uterus. So some people will say, oh, can they grow on ovaries? There has been maybe once or twice that they have been found on ovaries, but really they are all about the uterus, right? So that's why they're referred to as uterine fibroids. Now, they can be teeny tiny. Some women have them and never even know that they have them, or they can grow to the size of an 8-month pregnancy, which you can imagine takes up a lot of room and is not so fun for women that have fibroids that large. Now, often women won't know that they have a fibroid until it's about 5 or 6 or 7 centimeters, which is about the size of a large grapefruit. Unfortunately, once they are this size, they're usually causing some serious issues, as we're going to talk about here in just a minute. And they are harder to work with from a natural standpoint, but not impossible. I always like to let people know that. Okay, so let's talk about the types of fibroids and where they are located. There are multiple different forms, and really they can be all over the uterus. The most common you're going to find is the intramural fibroid, which you can see is here in the middle of the area, and it is basically going to be your least impactful when it comes to the symptoms, depending on the size, of course. These are the ones that can be pretty little and not grow that big, and women may not necessarily know that they have them. Next up is the subserosal fibroid, which you can see on this uterine area that comes both inside and outside of the uterus. And the problem with this is that it can start to bump up against local organs, including your colon or the bladder, and this can cause urgency and pain with these organs. They can also push on pelvic nerves, causing pain anywhere from the lower back all the way down the leg through the sciatic nerve. So it can make the whole area, unfortunately, feel not that great. Next up are our submucosal, and that's right under the uterine lining, aka the endometrium. And this type causes the most heavy menstrual bleeding and clotting. So I always say if you have a client or a patient that comes to you and is suddenly bleeding a whole lot more during their period, definitely go in for a vaginal ultrasound and see if fibroids are at play. This is going to be the one that's the most common when we do see that heavy bleeding. Next up is cervical. These are very uncommon. It's definitely in the cervix area. And then finally, you have the pedunculated, which can be either submucosal or subserosal, so either inside the uterus or outside of the uterus, and they grow on stalks. And you can imagine that when this breaks off the stalk, if it does, this can cause some serious pain and unfortunately can often lead to a surgical procedure needing to happen. Okay, so let's talk about fibroid symptoms. As I've already mentioned, heavy periods are going to be the most common sign that you have a fibroid at play, especially if the periods weren't heavy before and suddenly they become heavy. Um, Next up is painful periods that goes along with it. It definitely can make the whole situation a whole lot worse when you are having your period. And then you also can have fertility complications. Of course, as these fibroids grow in size, they can get in the way. And so that can inhibit getting pregnant and can also, if the fibroid's too big, not enable a woman to carry to term because the fibroid will take up too much space. Painful sex, back and leg pain, bloating, urinary incontinence, constipation, pelvic pain, weight gain, especially in that lower abdomen. These are all very common symptoms of fibroids because, again, you see this growing fibroid in this space. And the uterus is pretty small, right? And our whole reproductive area and our whole pelvic floor, there's a lot happening in there. So as that fibroid continues to grow, it pushes on those local organs. And that's what leads to a lot of those symptoms, along with just that general pelvic pain from this thing that really isn't supposed to be there being in this space. So here's the deal. Up to 70 to 80% of women are going to have a fibroid by the time they are 50. As I mentioned earlier, they may not know that. If it's small enough, it doesn't grow very big, then you're not necessarily going to know because the main way that you're going to find out that you have a fibroid is through a vaginal ultrasound, which is why I'm a huge proponent of vaginal ultrasounds in order to determine this, often much earlier than we actually get them done, right? It's often too late in the game by the time we use the vaginal ultrasound and figure out there's a fibroid. So black women tend to get them at a younger age, with one study finding that they develop fibroids an average of 4.9 years earlier than white women. They were more likely to be anemic from the fibroids, and they reported lower health-related quality of life scores. Now, this same study found that East Asian women were 2 years younger on average, had larger fibroids, and were more likely to suffer from anemia than white women, but had a lower symptom severity score. I have not really found any data on Latino women, unfortunately, when it comes to fibroids. And in general, we don't have enough data on what is happening when we're looking at fibroids, depending on race, genetics, all of these things. So in general, in my opinion, we definitely need more research, both on what underlies fibroids and then also how that shows up differently in different races, and utilizing, as I already talked about a minute ago, that vaginal ultrasound earlier in the game, particularly since we know Black women will, on average, develop them 4.9 years earlier. The earlier that we get in there when you utilize vaginal ultrasounds, the better outcomes that we're going to have, right? We're going to be able to work with them much more easily on a small, when they're small, versus when they get to this point where sometimes surgery is the only option. So quickly, this isn't really about allopathic approaches to dealing with fibroids today. That's a whole other presentation, but I do like to go over some of the basics of what the approaches are out there. So if you're not familiar with them, if you have a patient or a client that comes to you with fibroids, you can at least have this general knowledge. Feel free to reach out to me if you have questions about the pros and cons of each of these types of dealing with fibroids from an allopathic standpoint. I'm happy to share my thoughts on that. So first off, doctors will primarily recommend birth control or an estrogen blocker like Lupron to deal with fibroids initially, especially if they are on the smaller size. Unfortunately, with things like Lupron, which is an estrogen blocker, we're going to see women go into early menopause or deal with menopausal symptoms, which can be just as horrific as some of the symptoms that we deal with fibroids. In terms of lightening heavy periods, often doctors will recommend or prescribe tranexamic acid or an IUD to diminish that heavy bleeding. I am actually a fan of, if you want to call it that. I'm in favor of using tranexamic acid if a woman has been bleeding profusely for months at a time, and that happens in my practice. I've had women that have been bleeding nonstop for 60 or 90 days coming to me, and my opinion is that we need to stop that bleeding as soon as we can because anemia becomes so prevalent, and then start to work on the root causes from there. So it's a temporary band-aid, in my opinion, that can be useful. Next up, we have surgical options, of course, with hysterectomy being the most common recommended option, because they will say if you just get the fibroids out, they will grow back, which is a common occurrence because, of course, surgery is not dealing with the root cause of why you have the fibroids in the first place. So, yes, they are going to come back pretty often for women who have what's called a myomectomy, which is the removal of just the fibroids, and it leaves the uterus intact. So there's obviously different, things that depending on what you're wanting to do at that point, if you do want to have a child or not, if you want to keep your uterus, then the myomectomy is going to be a better option than a hysterectomy. Next up, we have UFE, which is otherwise known as fibroid embolization, and tiny particles are injected via a catheter to stop the blood flow to the fibroids, and the fibroids are supposed to shrink over the following months. In an endometrial ablation, this is used more often for other menstrual issues, but especially when it comes to heavy bleeding, it's used a lot. So it will be used in the case of fibroids sometimes when heavy bleeding is at play. And this is going to destroy the lining of the uterus, but it will not get rid of your fibroids. Next up, we have an MRI guided focus ultrasound, and that uses high doses of focus ultrasound waves to destroy the fibroids. And then we have radiofrequency ablation, otherwise known as Accessa, and this is going to apply heat directly to the fibroid, destroying the tissue and causing the fibroids to shrink. So some of these are a little less invasive than others, and we always want to think of, okay, what are the least invasive approaches first? Okay, so I just want to mention really quickly that fibroids are super common, particularly in perimenopause. This is when we start to see those fluctuating hormones, right? We see the estrogen starting to go up and be sort of all over the place, especially the first part of perimenopause. And we're seeing progesterone naturally going down. So if you do have a patient or a client come to you who is age 35 or over and is suddenly bleeding a whole lot more, go ahead and recommend that they get a vaginal ultrasound ASAP, because we want to either rule out that fibroids are at play or know that they are there. So really quickly, I just wanted to share with you what the fibroid size looks like, and to let you know that I had a fibroid when I was 39. I learned that I had one that was about 6 centimeters, which you can see on this little chart here is about the size of an orange. And what happened for me, I didn't really know much about fibroids before that. I started having that heavy bleeding that I've talked about already a few times today. And it was getting heavier and heavier for each period. And then also my period was what I say creeping up by about 5 days each month. So I had been a pretty regular for several years. And then suddenly it was 5 days earlier and then 5 days earlier the next month. And so I have no idea how long the fibroid had been growing at that point. It was something that, as I've mentioned a couple of times, a lot of times women won't know if it's not causing an issue that it's there. So by the time I found out that it was there, between the heavy bleeding that was causing anemia, it was actually pushing out my coccyx bone too. So it was creating a lot of pain in my lower back. After talking to my doctor and researching it, I decided to go ahead and have a myomectomy, which, as I mentioned earlier, is when you just remove the fibroid or fibroids and leave the uterus intact. Unfortunately, this surgery did not go as planned. I'll take that back. thought was it went perfectly during the surgery. They did it, they closed me up, they said everything went fantastically and sent me on my way. Unfortunately, I did land in the ER 2 weeks later with sepsis. And it turns out that they unknowingly burned me in 3 places in my intestines during that surgery. And really, when I was in the ER and they had to do the exploratory surgery to find out what was going on, that is when they found the burns. And the theory is that the burns started out very small during that surgery. And then just over the 2 weeks, they progressively got bigger as gastric juices, et cetera, was coming through my body. So at this point, when they opened me up, I had digestive juices, stool, and bacteria just dumping into my abdominal cavity. And I basically was in this place where my bowels were all blocked. They had to spend hours unwinding my bowels, and they had to clean out my whole gut with about 5 bags of saline solution, just on and on and on. And they tried to sew my colon back together once they found the burns, but my surgeon later told me that it was like trying to sew back together ground beef. So unfortunately, I ended up losing about half of my colon and about 8 inches of small intestine, and a temporary ileostomy, which you can see here on the left side of the picture, was created. I had that for about 6.5 months. And on the right side, they created a mucus fistula. And then because of the sepsis, I was unable to be sewn back up post surgery. So I got a womb vac that I wore for about 8 weeks. So here's the thing. I'm not here to say surgery is awful. You should never do it, right? But considering we do not talk about surgical mishaps often enough, and many clients that come to me are not told any of these possible complications by their doctor, I think it's really important in order to really have our clients and our patients understand the possible repercussions, that it's not just a simple surgery just because it's done often. So, one of the things I like to share with my clients was a study that found that large bowel injuries during laparoscopy are serious complications because 50% of bowel injuries and 60% of visceral injuries are undiagnosed at the time of primary surgery. So, I fall in that 50%. They didn't even know that the bowel injury had happened during the surgery. In another study, surgical site infections, otherwise known as SSIs, represent a well-known cause of patient morbidity as well as added healthcare costs. In gynecological surgery, particularly hysterectomy, SSIs are often the result of a number of risk factors that may or may not be modifiable, which can sound kind of scary, but I want to focus on the things that may be modifiable. And I hope that as we continue to research fibroids and fibroid surgeries, that we're going to start to understand those more and make some changes. There was a retrospective study between 1972 and 2014 that found that the overall incidence of bowel injury in gynecological laparoscopy is 1 in 769. Delayed diagnosis is associated with a mortality rate of 1 in 31. Now, I've had lots of conversations over the years with different OBs since this happened to me. And many of them think that these numbers are pretty low in the literature, that in fact, they're much higher. And you have to think that sometimes women don't even necessarily equate if they land in the hospital a month or so later that it had anything to do with the gynecological surgery that they had done. So we're probably looking at higher numbers than what the literature currently tells us. And this is just a reminder that no surgery is 100% safe without the possibility of complications. That doesn't mean we shouldn't have surgeries. Obviously, surgery saved my life after a surgery nearly took it, but I want it to be the last resort when it comes to gynecological issues. There's so many underlying reasons of what is going on, root causes that we need to look at before we dive into surgery. So let's start talking about some of those. What causes fibroids? Well, there's not just one thing, which I'm sure you're all similar feeling that so many things we wish it was just the one thing and we could give it to all of our patients or clients and it would work perfectly. Not the case. Not the case when we're talking about root cause medicine, right? So let's start off with kind of the big ones. Estrogen excess is definitely one of the main culprits when it comes to fibroids. Now, estrogen essentially does feed the fibroids. There's receptors on the fibroids for estrogen. And so the bigger it gets, the more it's going to take in that estrogen. Part of the reasons that fibroids become so common in women in their 40s is because you are naturally declining in progesterone levels, that post 35 time of life. And then you're also going to have just naturally high estrogen kick in, right? We're going to start to see more anovulatory cycles the deeper that we get into perimenopause. So for a lot of women, this is just on average, those mid 40s, creeping into the later 40s, we're going to see a lot more anovulatory cycles, meaning we aren't producing any progesterone that month. And then those extremely fluctuating estrogen levels that are happening at this point. So according to Dr. Laura Bryden, estrogen levels can jump to up to 3 times higher than when we were younger. But then they can also drop dramatically the next month, right? We're on a roller coaster ride when it comes to estrogen and perimenopause. I will say the majority of the women that I work with under age 45, they are experiencing pretty consistently high estrogen. Of course, this is not across the board. Testing is important to determine that. But if we're seeing fibroids, we're seeing ovarian cysts, we're seeing fibrocystic breasts, then we're most likely going to be dealing with a high estrogen issue. But more importantly, in my opinion, is how is your body breaking down or metabolizing that estrogen? So I'm sure many of you are aware that our liver does need to break down estrogen, just like everything else that comes in our body, and all of our hormones have to be broken down and moved out after we use them. So clinically, we know that a preference for the 16-OH pathway, and so this is in phase 1 of your liver detox, is associated with increased fibroid growth. Any kind of proliferative growth, think that 16-OH pathway. I will see just in my own practice that women with fibroids will just as often prefer that 4-OH pathway, which we consider the more DNA damaging pathway. So either 4-OH or 16-OH is going to be preferred over the 2-OH, which is where we want the majority of our estrogen going down that pathway, right? That is our protective pathway. So you can learn this if you're not familiar with understanding it. You can learn these levels on the Dutch test. It's going to show you your phase 1 and phase 2 liver detox. There's other hormone tests out there, including regular urine tests that can show you the metabolites of the hormones. So I highly suggest utilizing that if you have a client or patient with fibroids. Next up is adrenal issues. So stress is obviously has a major impact on your adrenals, creating this sort of high cortisol situation that many women are dealing with these days. And that can impact both your progesterone production as well as the uptake of progesterone in the cells. So this is another situation that is going to allow for estrogen to go more unchecked because we're naturally sort of having less of that good balancing progesterone, right? Estrogen and progesterone need a very good balance during the luteal phase of the cycle, or you're going to start to see issues beyond even fibroids. Hypothyroidism is something that I feel like is not discussed enough when it comes to fibroid growth, but there's actually a decent amount of literature around it. So in one study, overt hypothyroidism was associated with fibroids. And then another study showed that women with fibroids have an increased risk for thyroid cancer. Now, we know excess estrogen can actually be a factor when it comes to a low functioning thyroid or hypothyroidism. So, again, we're looking at this link back to estrogen and that elevated estrogen levels. And then deeper into that is the body not processing that estrogen and breaking it down well. Low vitamin D also seems to play a role in fibroids. We're going to come back to this in just a few minutes, but I wanted to just quickly mention it here. And now I mentioned obesity as a possible risk factor because it is well known in the literature as a risk factor. And this most likely has to do with the fact that estrogen, it hangs out in fat tissue, right? So the more fat tissue we have, then the more likely we're going to have high estrogen levels. But I work with just as many women that fall on the thin end of the line, and fibroids are just as common. So I don't really take that as a real indication, the size of a person, if they're going to have fibroids or not. That's just up to you to decide if that's something that you're going to look for more in your own practice. Okay, so let's talk about some lesser known or discussed or controversial causes of fibroids. Now, one of them is gene variations, right? So we're just kind of talking more in general in functional medicine about how impactful variations on genes can be. So, in particular, the COMT gene is one of the major players when it comes to estrogen metabolism, especially in that phase two liver detox. So, the COMT V158M and the COMT H62H has a 3 to 4 fold decreased COMT activity. So that means your body is not going to be breaking down your estrogen as well in that phase two if you have this gene variation. UGT genes also, they oversee glucuronidation, which is happening in that phase two. So if you have variation on this gene, it's going to also impact your ability to break down estrogen. Now, anecdotally, I've also seen that the genetics of a person with impaired methylation or that is predisposed to inflammation is also going to play a role. So, look at those if you are using genetic testing as part of your practice. Of course, we have endocrine disrupting chemicals all over the place in our world now. We often call the specific ones that are going to affect our system in terms of estrogen, we call them xenoestrogens. And I imagine that they have a much bigger impact on our fibroid growth than we're even aware of now. There's not a lot of specific research on this, but there is some research. There are some epidemiological studies that suggest exposure to certain EDCs, such as platelets, are associated with increased fibroid risk and severity. Copper toxicity, I just recommend, I reference this because it's copper is a hotly debated topic, I think. And of course, are we talking about bioavailable copper or copper that's bound and all of these things? But we do see that when there's higher copper in the body, there's often higher estrogen levels. Particularly, we'll see that with the copper IUD. And so here we go again with those elevated estrogen levels. So this can be a part of the picture. Immune upregulation. Now, there's one study that noted higher numbers of macrophages were found inside and close to fibroids as compared to the more distant myometrium. Now, there is a hypothesis that the extracellular matrix or the ECM that makes up fibroids is caused by excessive wound healing driven by, you guessed it, inflammation. And those macrophages could be part of what is considered an uncontrolled tissue repair process. So essentially, they're saying, hey, these fibroids are growing in size because, there's inflammation going on in this part of the body, and this is how the body is healing it. So I want you to keep that in mind as we talk about some of the ways that we can support our bodies when fibroids are at play or if we have risk factors for them. All right, so we're going to talk about where do we begin with dealing with fibroids? And it is so important to really tackle all of these areas: your food and your gut health, your liver health, and your stress reduction and adrenals. Let's dive first into food and gut health. Now, without a doubt, across the board for any hormone issue, blood sugar regulation is key. We know that blood sugar regulation is important to keep inflammation down. And as we were just talking about, inflammation is more than likely a pretty big factor when it comes to fibroids. It's also important to maintain good blood sugar regulation in order to keep your adrenals happy, right? And so we know that process of adrenals impacting fibroid growth too, which I'm going to talk about here a little bit more in just a moment. In terms of specific foods that I find very useful and really in general, when there's any kind of hormone issues, I recommend my clients dive deeper into. And number one is cruciferous vegetables. Now, there was a Chinese study that found cruciferous vegetables like broccoli and cauliflower act as protective factor against fibroids. We know that there are many, many cruciferous vegetables out there beyond just what I just mentioned. That you've got the bok choys, you've got the greens. So bringing more of those into a body that is predisposed towards fibroids, I think is a great idea. Next, a greater intake of fruits, veggies, and vitamin A were found in a study published in the American Journal of Clinical Nutrition in 2011, excuse me. They were found to reduce the risk of fibroids. So here we go. All kinds of things that are going to generally keep inflammation down, I do want to mention, because they just said vitamin A is a really important part of it, there's a huge debate in the fibroid community when it comes to eating meat. Meat is obviously a very good source of vitamin A. Some people believe that fibroids grow quickly when people eat meat, but I've seen just as many vegans have fibroids as I've seen meat eaters. Jumping back up to what I just said, blood sugar regulation is so important when it comes to keeping fibroids at bay. And for most people, some level of eating meat is going to be very important to keep their blood sugar stabilized. So I lean towards the side of eating obviously as clean of meats as you possibly can, but that is a good source of supporting your body if you're dealing with fibroids. Now, certainly cutting down or completely out caffeine and alcohol. There was a study called the Black Women's Health Study, and it was published in 2004, where beer drinkers were found to have a 50% increased risk for developing fibroids as compared to those women who did not drink. That's massive, right? And we can pretty much extrapolate that goes beyond just beer to other forms of alcohol, and definitely impacts all women's bodies. As with nearly all health issues, we certainly need to tackle our gut health in order to make sure that we are digesting well, that we're not causing inflammation, and that we can absorb the nutrients from our food that are important to keep fibroids not happening and not growing in our bodies. So, in terms of phase 3, so we've talked about phase 1 and phase 2, detoxification happening in our liver. Phase 3 is going to happen in the gut. So we want to make sure that our gut is nice and healthy, that it's going to move that broken down estrogen out of your body. We don't want it hanging out in your body. We don't want to give it a chance to recirculate in the body. And keeping the inflammation down is also going to help neutralize impacts on our hormone receptors. I'm not going to go into all the specifics today because we don't have time in terms of the basic supports for gut health. I'm sure you're educated on a lot of these, but I just want to mention really quickly, I think the foundations of gut health are so key for so many people. So does your patient or client have enough hydrochloric acid going on? How are the digestive enzymes or pancreatic enzyme output? How is the gallbladder working? All of these, a lot of people need some good supports around. And so getting into testing to see where those are at, utilizing some supplements to support those body systems can be a really good idea overall. And then obviously a quality probiotic, once you sort of determine what the levels of different bacteria are happening in your gut. And that you can find out on testing, gut testing. So next up, let's talk about liver health. I've already talked a lot about the liver today and how important it is in metabolizing that estrogen in both a phase 1 and phase 2 liver detox. So beyond that, our liver plays such an essential role in so many things in our bodies, including maintaining those good, healthy blood sugar levels. And this is intimately also connected to our cortisol output. Blood sugar goes up, cortisol is going to go up. So some of my favorite things for supporting the liver include very simple lemon and warm water first thing in the morning. Super easy for most people. If you are low on sodium, just add a little bit of sea salt to that too. Minimizing drugs and alcohol, as we've already discussed, and then herbal supports that are going to support the liver. Some of my favorites include Hepatotome Plus, which is from Designs for Health, and also they have a great B vitamin called B Supreme, and particularly in phase 2 liver detox, you do need those B vitamins. Next up, removing those xenoestrogens. Now, there was a 2014 study that found chronic exposure to particulate matter 2.5 may be associated with a modest increased risk of fibroids. And then a 2009 study demonstrated that these persistent organic pollutants and some heavy metals may have correlations with fibroids. I'm sure it's much deeper than that. I'm sure that heavy metals play a massive role in fibroid growth. And unfortunately, we are surrounded by a lot of these pollutants, right? So the things to really focus on that we have control over: skincare, makeup, shampoos and conditioners, what we clean our houses with, not drinking out of plastic, not storing our food in plastic, keeping those of your in your environment, especially in your house, is going to make a massive difference. So really you focus on that with your clients and your patients when there are hormone issues at play. Physical detox supports. This is an area that I feel like a lot of people don't focus on enough because, as I just mentioned, we have chemicals everywhere, right? So we can bring down, we can't fully eliminate all of those in our close environment, but we're definitely not going to be able to eliminate those out in the world. So utilizing physical detox supports is just going to help your own body's systems, your liver, your kidneys, your colon, your skin, these detox pathways to be able to do a better job, right? So infrared saunas is one of my favorite, absolutely. Red light therapy is great, and that also helps a lot with inflammation. Epsom salt baths, castor oil packs, enemas if we are working on some gut health and we just need to, get stuff out of our bodies. That's also going to all help with getting xenoestrogens out of your body. And then finally, if you know anything about Chinese medicine, you know that the liver is the center of where we hold our anger and our frustration. And so many women have experienced, I mean, everyone literally on earth has experienced trauma in their lives. And not every one of us has processed that trauma. And I do believe we hold a lot of that unprocessed trauma as women in our liver. And maybe it could be things from childhood. It could be things continuing to happen now where women feel like they can't express their feelings completely. Working with a therapist on this area, I think, is extremely important when it comes to fibroids and really processing and moving those old emotions out of your body. Okay, next up is stress reduction and adrenals. Now, your body's always going to favor cortisol production, aka your stress hormone, over sex hormone production. As your body focuses more on that cortisol, your sex hormone production is actually going to be blunted. So I see it again and again when I run a Dutch on clients. Cortisol is either way high across the board, or maybe they're at the point where it's very low across the board because the brain has figured out what we're doing is not working. And so it will actually down regulate the cortisol. And this is when you see women who struggle to get out of bed. They can't really get through their day. It's really tough. So I always start my clients on adrenal support because I don't have one single client that comes to me that doesn't need some adrenal support, and work on lifestyle changes because that's key. I do believe that my own story and my own stressed out hustle nature before I found out I had a fibroid was actually a huge part of that fibroid growth. So don't discount how much of an impact this can have on fibroids in your clients and your patients. There's lots of good adaptogenic herbs out there. I'm not going to go into recommending that many right now. I do like Designs for Health's Adrenatone if you're just going for straight adaptogens. There are some women, as I mentioned, that are just low in cortisol across the board. So we may start off with adrenal complex glandular in order to help just boost their adrenal function a little bit, and then move on to adaptogenic herbs. Now, specific ways to approach stress reduction include setting boundaries. This is massive for so many women. They really struggle to set boundaries, both in their work life, in their personal lives, and even internally. And so learning how to do that well is going to have such a massive impact on how we function in the world. Stepping out of that hustle mode that became so popular about 5 to 10 years ago, I think we're starting to unwind from that a little bit, but it's still prevalent in a lot of ways. And you kind of have to decide you're going to step out of it, right? The world's going to always want more from you, but you can say, nope, I'm going to only focus on, a couple of things at a time. Of course, parasympathetic activation is massive. We've got to get out of our sympathetic nervous systems much more. And so things like meditation, visualization, deep breathing, getting your hands and feet in the soil, all of these are options to just pretty quickly get you into your parasympathetic nervous system. And I always say, find something that you actually identify with and that you can do consistently. Some people don't like meditation. They're not going to do it consistently. So it's not going to help, right? It's something that we need to do really daily. Start with 5 minutes. This is what I always recommend to my clients. If you don't like meditation, maybe you can find a visualization on Insight Timer is a great free app. And, the guided visualization works much better for you. Try different things and then make it a part of your daily practice. And then finally, changing mindset about stress. And I don't say this lightly because I think that you have to work on underlying trauma issues first before you really can make mindset the thing that's going to change everything. But Mindset has a huge impact. There was a study done where a group of people were shown a video of stress as debilitating, and then another group was shown a video of stress as enhancing. And what they found was the levels of DHEA, which is considered our brain enhancing anti aging hormone, actually increased quite a bit with that video as stress as enhancing situation versus it did not rise with the video of debilitating, as stress is debilitating. So we can really see here how stress and the way that we view stress can have a huge impact on our hormones directly. So this is what I like to call a more advanced approach to dealing with hormone issues. All right, let's get into some of these natural fibroid therapies that are so important. So first of all, you've probably, if you know anything about fibroids, have heard about utilizing DIM. So DIM is definitely very potent and can be very, very helpful with pushing that estrogen down that 2-OH pathway where we want it to go down, that protective pathway, and away from the 4-OH and 16-OH proliferative pathway. The CYP1A1 enzyme that breaks down estrogen in phase 1, those levels rise and fall throughout the day, and that's based on one of our circadian genes. And research indicates that maybe taking DIM earlier in the day might be more effective than at night. So that's just a little hack for you to share with your patients and your clients around utilizing DIM. I am a huge fan of Designs for Health's DIM Avail, and I do utilize it with most of my fibroid clients. But I do not use DIM on its own. DIM is going to upregulate that phase 1, but we want to make sure phase 2 is working well because things can get uglier if we don't make sure that phase 2 can handle everything that phase 1 is now processing better. So I usually utilize calcium D-glucarate. There was a study that found that several weeks of high-dose calcium D-glucarate lowered blood estradiol by 23% in animals, and one clinical trial with 95 women, a combination supplement containing DIM and calcium D-glucarate, along with several other plant-based nutrients, improved estrogen metabolism after 28 days. Now, based on this effect in clinical experience, there are some health professionals that recommend calcium D-glucarate at 1,000 to 3,000 milligrams daily for conditions not only fibroids, but also with PMS, polycystic ovary syndrome, aka PCOS. We do also know that CDG can help support with the UGT gene variation that I talked about earlier that can diminish that phase 2 breakdown of estrogen. So I'm a big fan of utilizing calcium D-glucarate, and I use it myself all the time. Next up, we have NAC or glutathione. So both NAC, which is, of course, the precursor to glutathione, and glutathione itself are extremely important for your liver health. Now, I often do see low glutathione levels on the Dutch for women who are struggling with that phase 2 detox and or fibroids. So I like Designs for Health's NAC product because it has 900 milligrams instead of many of the products out there will be on the lower end, 400 to 500. And I really see that 900 to 1,000 milligrams is what we're going to get much more bang for our buck at that level. All right, thyroid support. I mentioned earlier how important it is to really start to look at when there is hypothyroidism at play, this connection that may be happening with fibroid growth. So starting out with obviously testing your patients and your clients, testing their thyroid levels, seeing where everything is, do a comprehensive thyroid panel. And then see if you are able to do some nutrient testing too, see if they're low in some of the nutrients that are important for good thyroid function. I often do use something like Designs for Health Thyroid Synergy as a starting point. In some cases, prescription medication is necessary. It is what it is. So Armour and P-thyroid are naturally desiccated thyroid hormone that can be prescribed by a doctor, and sometimes additional T3 is needed. I am one of those people who genetically does not convert my T4 to T3 very well, and so I need additional T3. So it's really important to look at those free T3 levels. Vitamin D, as I mentioned earlier, is an important factor, and here's why. There are several studies that have connected the low vitamin D to fibroids, and one in particular found the prevalence of vitamin D deficiency in women with uterine fibroids was 85%. That's massive. So definitely check your patients and your clients' vitamin D levels if they have fibroids. Turmeric has been shown to inhibit fibroid cell proliferation and production of the ECM component fibronectin. So it also binds and activates the PPAR gamma, and that in turn can possibly help shrink fibroids. We need more research done in this area. Hopefully, it is coming soon. Next up, we do have our green tea extract, and this is actually one of my favorites. In one study, women with fibroids were given 800 milligrams a day of a decaffeinated EGCG-rich green tea extract, which showed significant reductions in fibroid volume and symptom severity, along with less bleeding and better quality of life. And it seems like in some cases, it can be just as impactful as Lupron, and that's huge, right? So why not try some green tea extract first if fibroids are, an issue, but it's not at the place where we need to consider surgery yet. Next up, we have melatonin. It hasn't been tested in women yet, but in a preclinical trial, melatonin selectively triggered apoptosis and autophagy in fibroid cells while sparing the normal uterine muscle. Resveratrol, same thing. It's also preclinical studies, but we can see here, if you've noticed, the resveratrol, the melatonin, the green tea extract, the turmeric, these are all anti-inflammatories that we're really seeing can help blunt fibroid growth. So again and again, let's come back to thinking about anti-inflammatory in nature, anti-inflammatory diets, all of these things when it comes to dealing with fibroids. So really quickly, some promising or controversial therapies, bioidentical progesterone. So here's the thing. A lot of people will believe it's low progesterone and high estrogen that is causing fibroids, but it's not that simple. So we do know that fibroids actually have progesterone receptors on them too. And this is where the debate comes in, right? So Dr. John Lee, who's the author of What Your Doctor May Not Tell You books, wrote that bioidentical progesterone can help shrink fibroids if they are under the size of a grapefruit, but help them grow if they are bigger. Well, who knows, right? At this point, it may be. We know that essentially all of our cells have these hormone receptors on them, and as the fibroid grows larger, it's going to have those progesterone receptors grow in amount too. So what I would say about this is take caution. I would say even over 5 centimeters, the fibroid's that size, if your patient or client wants to utilize bioidentical progesterone, because it can be helpful and it can also help with the continued growth of it, versus if it's more the 2 centimeter, 3 centimeter, you may not have to worry as much about the growth happening. But I do recommend go ahead and do those vaginal ultrasounds every 3 to 6 months if you are utilizing bioidentical progesterone. Next up is proteolytic enzymes, particularly serrapeptase and nattokinase. And they are said to kind of eat away at the fibrin in the fibroids. But I've not personally seen them work that well to get rid of fibroids. I don't think it's a bad thing to try. I think these are great sort of scavengers and cleanups of lots of things in our bodies if we take them away from food. So I don't think it can hurt, but don't depend on it necessarily diminishing fibroid growth as much as you would like. Castor oil packs are also said to support detoxification, especially if you put them over your liver. Haven't found any connection to diminishing fibroids in studies. There's a lot of people out there that claim that it does, but we don't necessarily have the literature to back it up. But I think, again, it's not something that's going to hurt, and it helps so many women get in their parasympathetic nervous system that I really like utilizing castor oil packs. This is pretty interesting, sort of coming up. We need much more research around it, but injectable collagenase that comes from the bacteria Clostridium histolyticum was found in one study to have a 39% reduction in collagen content, which is a very, huge part of those fibroids. The collagen fibers to be shorter and less dense, and subjects reported a decrease in fibroid-related pain after injection. So this is very much in its infancy of studying this, but Johns Hopkins is studying both this and green tea extract as alternatives to surgery. So I'm pretty excited about this possibility on the horizon. And then finally, iodine. So there's lots of studies out there that have shown that iodine can help with fibrocystic breasts. And so some experts extrapolate this to also be helpful with fibroids too. I think it's very important to dive into making sure our iodine levels are good, because we know how important it is for our thyroid health too. So test, make sure that we don't have any autoimmunity at play, and then, consider maybe utilizing some iodine too. Finally, The emotional or energetic aspects, I just want to mention this really quickly. So, from an emotional standpoint, there's the idea that we are creatively blocked when we have fibroids. And I see it in all of my clients as this feeling of complete overwhelm or not feeling supported in their endeavors. And I think sometimes fibroids can be a sign from the body that things need to change in their lives. Also, just being disconnected from our body, particularly our reproductive area. And then there's lots of reasons for that, right? From trauma to, survival, all of these things. But we really have to work on those areas and get reconnected in our bodies to both deal with fibroid growth and also overall to heal, in my opinion. Okay, so that is my presentation on fibroids. You can find me online at all the places. I have a website, christinegarvin.com, and then basically Instagram, YouTube. Those are all Christine Garvin. If you look me up there, you can email me. I do have a podcast called Hormonally Speaking, and I have an online hormone school called Get Your Hormones Right. And we are doing a live program starting November 6th called Perimenopause Like a Boss. We're running this fabulous program again. My colleague Marika and I do this program. It's a 5-week intro program. So if you or some of your patients or clients need some help with really getting a handle on the changes that happen in perimenopause and what to do to help you navigate and maybe even make it an exciting process, come join us. And we do have a special $80 off if you sign up by next Monday, if you use code mindfulness at checkout. And so you can go to my website and find that. So that's it.
Thank you. Thank you so much, Christine. What a wonderful presentation.
Thank you.
All righty. So we're just going to dive into the questions here. We have a number of them, and I apologize if anybody is having any issues getting the slides. You can email me. My email address is amy.regan, REGAN, @fullscript.com. I'll reply back to everybody who I've been chatting with, but please send me an email there and I'll send them out to you as soon as possible. So let's just start from the top. Paula asks, would taking collagen exacerbate either fibroid frequency or density?
Good question. I get asked this a lot. So as far as I know, no, right? Because when you eat any kind of food that has protein in it, your body has to break it down. Your stomach breaks it down into amino acids, which is essentially what collagen is, right? Collagen is a little bit closer to those already broken down amino acids. And the thing is, your body is going to utilize those for whatever you need in your body. And so, for example, a lot of people will take collagen because the hair, skin, and nails thing, right? They're like, yes, I want to improve those. But if you have other parts of your body that need those amino acids, then it's not going to go to your hair, skin, and nails. So basically, your body's going to decide where it needs that collagen to go, aka the broken down amino acids. So I don't think it's an issue personally, because again, we need so much protein support in our bodies to maintain that good blood sugar regulation. And I haven't seen in my practice that the collagen increases fibroid growth at all.
Excellent. Susan asks, what is the difference between, excuse my pronunciation here, pedunculated fibroid and a uterine polyp?
Oh, so polyps are just different things than fibroids, right? And I honestly, off the top of my head, I don't know what the polyp is made up of exactly. I know a little bit more about the polyps, the colon polyps, but it can cause some of the same issues. So it's a little bit easier to remove the polyps in general. Often they don't have to do surgeries in order to get rid of them. And as far as I know, they're kind of not as strong and dense as fibroids.
Excellent. Hold on one second, everybody. I'll just get back to where I was. Excellent. So Diane asks, is there any research on why Black women tend to get earlier fibroids, and what's the cause of these fibroids?
It's a great question. And there's not really great research on it. I was just talking about this with a friend this weekend. And this is where I want the research to really step up. There is some theories around just greater collagen production in Black women's bodies. And then we do know in general, Black women will deal with lower vitamin D levels. So, these may be part of the issue. I also think that there is, Black women face a lot of trauma in our society too, from a very young age. And I think that's also probably part of it. But yeah, we really need some deeper research into this, in my opinion. And I mean, I've worked with Black women and have friends that they've developed fibroids in their early 20s, and so to me, it's like, let's get vaginal ultrasounds. Let's at least do something that we know we can do and get vaginal ultrasounds going when women are in their late teens or early 20s, so that we can see this and we can start to do some of the things I've talked about today to keep them from growing further and hopefully shrinking them to nothing too.
Excellent. Asma asked, does the size of the fibroid depend on the woman's uterus size?
Not that I know of, so the uterus is pretty small, right? I mean, it's pretty amazing. Like, I didn't really know what the size of it until after my surgery. It's just this little tiny thing. And so it's pretty amazing how massive these fibroids can grow. As I mentioned, a full term pregnancy, essentially, hopefully not much larger than that, because you're definitely getting it taken out at that point. But yeah, as far as I know, there's no connection to the actual size of the uterus, how many or how big the fibroids will be.
I see. Paula asks if 4-OH and 16-OH pathways are associated with fibroids. Mm-hmm. Would DIM/13C be helpful?
Yes. Yes, absolutely. So those are both going to help with pushing down that 2-OH pathway. And again, the literature connects fibroid growth more with the 16-OH pathway. It's known as that proliferative pathway, but I've seen it just as often prefer the 4-OH pathway. But DIM is going to help with either of those situations. It's going to help push down that 2-OH pathway in most cases. I won't say always, but in most cases.
Excellent. Julia asks, can fibroids reduce in size for any reason or over time?
Yes, I think that sometimes nature just works and things happen where they can reduce in size naturally. We do know that fibroids tend to grow either if you've already had the fibroids, and sometimes they'll pop up for the first time in pregnancy, because you think we have all these hormones going on, and often those fibroids will shrink after giving birth. But generally, as compared to, say, like ovarian cysts, where the body will kind of take care of those cysts over time. And that's not across the board. Of course, sometimes ovarian cysts can get very large too, but those fibroids, I just think of this dense thing that kind of wants to grow. And so we have to come in and do something different, right? So really hitting it up from the physical, the mental, the emotional standpoints, all of those points we've covered today, that's going to give you the best basis and foundation for shrinking fibroids. And again, I mean, I've seen it happen with women that have 10 or 11 centimeter fibroids, right? It may not happen super fast, but it's going to happen over time. But the smaller the fibroid, the quicker those things start to help, in my experience. And that's why we want to know as soon as you have one, essentially, not before it's huge.
Yes, excellent. So we have a number of questions and we are getting close to the time. So if everybody's cool, we can continue answering some more and go a little bit over. Okay, perfect. Thank you so much, Christine. So can you mention the herbal supplements and vitamin B supplement that you use again? Diane was wondering.
Oh, yes. So for the liver, I really like Hepatotone Plus from Designs for Health. I will say in general with liver supports, I like to rotate on different supports, right? In general, I don't like to put clients on one particular supplement for longer than 3 to 6 months, depending on its usefulness and everything. But I feel like the body adapts to the different supplements. So certainly I like to bring in other herbal supports. And sometimes, we'll do Hepatotone Plus for a while, and then we'll focus on NAC or glutathione and kind of rotate from there. In terms of the B vitamins, it's B Supreme from Designs for Health is a good overall B vitamin. And, there's a lot of debates around the specifics around B vitamins now. I tend towards, I used to do sort of the higher, like 1,000 milligrams of the B12, the methylated B12, but that can be too much for a lot of people. So I like versions that hover around more about, 400 to 500 milligrams of B12, and maybe like 600 to 700 milligrams of the folate and that kind of thing, and just good general support for most people. But definitely watch people's reactions to it too, to make sure it's working for their body.
Excellent. Jennifer is wondering, have you seen any benefits from a ketogenic or carnivore diets on shrinking fibroids?
So I will say I've known of some people, particularly carnivore. Ketogenic, I think I've heard a couple of situations where, yes, it was helpful. And then I've heard a couple of situations where it didn't seem to make a difference. Carnivore, on the other hand, has seemed to maybe work a little bit better. And I think carnivore can be a very useful diet for a period of time for different hormone issues. But what ends up happening over the long term with carnivore is we see women start to lose their period. We do need some carbs in order to maintain good adrenal function and hormone production and everything too. So I think it can be a really good stopgap for anywhere from like 3 months to a year. And if a client or patient is ready to do that, I think it's a good thing to try, especially with those larger fibroids. But then at some point, you're probably going to want to ease them off the diet.
Excellent. Andrea is wondering if you have any favorite nutraceuticals for heavy menstrual bleeding. If there's anything you go to.
Let me think about this. I think the heavy menstrual bleeding, we just really kind of tackle it from these different inflammatory points more than anything else. I do utilize Inflammatone, which is also from Designs for Health, is a good combination actually of a lot of the anti-inflammatories that I spoke about today. And I think of it as a natural ibuprofen, essentially. And so that can help in diminishing both the pain and some of the bleeding. Unfortunately, with fibroids, particularly depending on the location, it can be harder to stop the bleeding than I think other forms that we would use. And that's why in many of these cases, if somebody's bleeding for a long time, we'll look at the tranexamic acid for a period of time just to get them to stop bleeding. Of course, another thing with heavy bleeding, which is frustrating, is the more that we bleed, the more iron we lose. But the more iron we lose, the more we bleed. Mm-hmm. And so I'm not a huge fan of iron supplementation for a long period of time, but often clients come to me where their ferritin is literally like 2 or 3. And if they aren't able to do iron infusions, then we want to look at definitely supporting their iron to go up. And as iron increases, often that will help with diminishing the bleeding a bit too.
Excellent. So we are a little bit over. And the last question that I wanted to ask was, do you see patients yourself?
So I am actually just stepping out of my one-on-one practice, but I do go into all kinds of things about fibroids in my programs. So I highly suggest, especially I will be creating a full-on fibroid program, hopefully next year, but we dive a lot into it in perimenopause like a boss, because it's part of that bigger picture for so many women in perimenopause. And yeah, feel free to send me any questions too. I'm happy to answer some questions.
Excellent. Well, as we sort of wrap up here, do you have any sort of final thoughts or just kind of thinking about what we discussed today and sending us all off to enjoy our afternoons?
Well, I think if you yourself are dealing with fibroids, or if that's a big thing in your practice, there's been a lot of like hitting our heads against the wall when it comes to fibroids. And I hope that you took from today that we do have some more power over fibroids and our just reproductive health in general. And I'm glad that we're living in a time where we're talking about this much more, because women didn't have these options or choices for so long. And so really knowing that we have the strength to heal our bodies, and we have the strength to really listen to our bodies and pay attention to what they're telling us is such a beautiful and amazing thing. So I hope that all of you are able to feel that way too.
Yes, definitely. That's a perfect sum up for us. I just want to say thank you to everyone who attended today, and also thank you so much to Christine for this great presentation. Please look out for an email with a link to view this recording over the next couple days. If anyone has any additional questions, they can send them right to me. I hope everyone enjoyed the presentation and has a great rest of their day. Thank you so much, Christine.
Thank you. Thanks, everyone.